Good morning, everybody. I'm Joel Green on your hometown station, KHTS AM 1220. The subject today on Senior Moments is how can the Santa Clarita Senior Resource Alliance help you? Our guests are Mary Demkowski, Marketing Director of Oakmont of Santa Clarita, and Flora Greenhill, Hospice Community Liaison, Assisted Home Health and Hospice. Phone lines are open if you have a question for either Mary, Flora, or myself, Joel. The number is 298-5487. Mary, when people come to Oakmont and they're shopping around for perhaps assisted living, what are the things that people would want to ask of an assisted living community?
Well, I think it all starts from, as Flora's mentioned, that initial phone call and that first impression, which I feel is so important. So when most people will call us first and inquire and just, want to get some basic information. And we always, you always want to, or when you're talking with that in that initial conversation, is the person on the other end of the phone welcoming? Are they inviting you into the community to tour? Is your call put on hold? Even the simple things like that. This is a difficult decision for families, and oftentimes they're reaching out. You're the first person that they're speaking to about this, and so is that person on the other end of the phone, again, welcoming and inviting you to come to the community, and that's usually our first step, is getting the adult children or the residents to come into the community, meet the executive director, meet the staff is so important. And is someone sitting down with you and actually listening to your story, because everyone has a different story, different reason for maybe taking this first step. Maybe they have no idea how all this works, or maybe you're the third or fourth community that they visited. But to have that listening ear initially to find out what exactly is going on in that situation, and then being able to see how those needs can be met, if they can be met in the community. And just to kind of a little side note, being a part of the Senior Resource Alliance is, we are a resource for families. So if someone should come into our community and maybe this isn't the time for assisted living, maybe starting with some in-home care, or they're concerned about how do I pay, and being able to refer them to people that can help, that are part of our alliance, is just been so valuable to us, and being able to help those families with those questions in regard to different issues.
And that's really what a resource, that the middle name of the Senior Resource Alliance is. It's a group of professionals that can answer questions. It's a group of professionals that certainly can provide direction for families that might not know the answer, and in many cases, I would guess, don't even know the right question.
Exactly. Yes.
We talked about assisted living. What does that mean, assisted living?
So assisted living is basically a home setting where people reside that need assistance. An independent living community would be, say, your over 55 community, where there may be activities provided, but the residents that live there are really on their own for everything else, for taking care of themselves, for cooking their own meals, for transportation. An assisted living is, again, a home-like setting where assistance is provided, and it can just be someone is really unable to maintain a home and doesn't want to cook anymore, and keeping up a house is becoming difficult. So an assisted living provides the environment where they can still have their independence, have their own apartment home, but not have to worry about the preparation of meals, not have to worry about the maintenance of a home. Social activities are provided within the community. So if maybe now unable to drive and can't get out to those social activities. It's all provided within the community. You could have someone that maybe had a fall recently, and now ambulation is an issue, and it isn't really safe for them to be in the home anymore. They might need a little assistance with bathing or getting dressed because of that. That is all provided in assisted living. So we always say it's the best of both worlds. Having your independence, but if the help is needed, it's right there within the community.
I think the old vision of assisted living is that we all go down to eat at 4:30, and the dinner menu today is Franks and beans. And for breakfast tomorrow, we're all going to have oatmeal. Is that kind of how it is, or not really?
Well, yeah, I think it's a little bit different. Food is, of course, a very important part, and it's very important to seniors. So at Oakmont, just to share a little bit about our community, we have a restaurant-style dining, and we do offer anytime dining. So our residents can come into the dining room and have a meal anywhere from 7:30 in the morning to 7 at night. So if someone isn't an early riser and is afraid they're going to miss breakfast if they don't get to the restaurant at 9 o'clock, they don't have to worry about that. They can come in anytime and have a meal. We have an executive chef that has recently come on board with us, and he is working on designing our menus, and actually I think today he's going to be cooking for us for the first time. But he comes with a background in assisted living as well as a extensive culinary background. And so, yeah, Franks and beans, yeah, it might be on the menu if that's something that our residents enjoy, but it's really that 5-star dining experience that we are very proud of at Oakmont.
When you say menu, you actually mean choices.
Choices, absolutely. And I had mentioned the diabetic program, so we have diabetic friendly choices, heart-healthy choices on the menu. The menu changes. It is not, a fixed menu, and there are many choices on a daily basis.
And you can obviously, do other assisted livings other than Oakmont, should I expect the same thing at every assisted living?
The anytime dining is not always standard at all assisted livings. That's a choice that Oakmont, that's an option that Oakmont chooses to offer. But there should definitely be variety on the menu. And, I always encourage, if you are touring a community, ask if you can have a meal there. Ask if you can have lunch. And usually they will offer, so that you can see the quality of the food. But yes, because food is again, a very important aspect of the community, most assisted livings, would like you to come in and invite you to try the food so that you could see for yourself.
So assisted livings really can vary, though. They can vary as far as surroundings. They can vary as far as menus.
Yeah, absolutely.
And activities.
Yeah, I mean, it can vary. The size of the building in itself can vary. If Oakmont, we have a huge piece of land, so we're very spacious with lots of outdoor areas. If you have assisted living that's maybe in a downtown area and they don't have as much space, maybe they don't offer that. They don't have as much outdoor space. Another thing is if you have a pet and you're bringing a pet. We encourage our residents, if they have pets, to bring them along. But if you do have a pet, you want to look for a community that is pet friendly, and do they have an area for the dogs? And we have a huge pet park. I mean, that's just a feature that we offer. Activities as well can vary. Based on really the culture of the community. At Oakmont, all of our residents are brand new coming in, and our activity director will be meeting with our residents to find out what types of activities are important to them. Of course, we're going to incorporate the important things like exercise and music, and those that are interested in art and cooking demonstrations. But activities can definitely vary, but you want to ask the activity director if you're on a tour, what kind of activities do you offer? Share, if your mom has an interest, share that interest and see if there's something there that would meet that interest.
And that's really, really important, is that not every community is a match for every individual.
Exactly.
And due to finances, due to location, due to programs offered.
If your loved one has memory issues and they don't offer a memory care community, obviously that may not meet your need. And financial is definitely something to take into consideration, and working with something that is within your budget, and we can help with that. If we're not the right community, we can certainly refer you to others in the area that might work better with your budget.
And again, very important. Flora, for hospice, I'm going to assume that all hospices kind of do the same thing, or at least they say they do. But what does a hospice specifically do? What does assisted specialize in?
Well, you're right, Joel. Hospices are required to provide certain services by Medicare, home health aides. We're all required to have spiritual support, a social worker, and of course the nursing care, and we do need to be available 24 hours a day. I think there are two things that also set assisted hospice care apart. One of them is our respect for the families. When we go in, and for our patients, when we go in and see a patient, by the way, we see patients in their home, whether it's a private house or an assisted living community, or even a skilled nursing facility. We see patients wherever that patient lives. We always remember that we are a guest in that patient's home. We're here to serve the patient and serve the family. At assisted hospice, we are never going to impose our agenda or our protocols on a patient or on a family. Part of our consent form that every family signs or patient signs before they can start service says that the family and the patient have the right to play a key role in management of their care.
What does that mean?
We want the family to have a voice. Hospice is about teamwork. We have a team, the nurse case manager, another LVN nurse, spiritual care, social worker, as well as the whole team, our doctor, our director of patient care services. We often have care plan meetings with the family because we want the family to be comfortable with how we're managing symptoms. We want the family to be comfortable asking any questions, or if they have suggestions, we want to show them that we will listen to them and we want them to be heard. For us, it's all about communication. It's funny, we have daily reports, which are called DVRs. They're sent out in a confidential, privacy-protected email to everyone on the team. And every nurse, every social worker, anyone making a visit to a patient sends out a daily visit report at the end of the day talking about the patient's condition, any changes in the plan of care, any new medications that need to be refilled, anything going on with that patient. What that means is if there's an urgent need in the middle of the night or on the weekend that's not planned, and that happens often, everyone on the team, including the nurse on call, knows what's going on with that patient at any given moment, and we can refer back to that. I think communication is so important, and we want the family to communicate with us as much as we communicate with them.
At Home Instead, we deal with a lot of clients that are on hospice. And one of the things that we recommend to families is that when they choose a hospice. By the way, can I choose a hospice?
Yes, Medicare gives you the right to choose any hospice provider you wish.
But what if my doctor says, I'm assigning this hospice to you?
Actually, the doctor is not supposed to do that.
Really?
A lot of times the doctor will recommend a hospice that they're working with. You can always say, I'd like to explore talking to another hospice and then see which one you feel is a better fit. Most of the time, the patient's primary doctor does not manage the care when a patient goes on hospice. The care is managed by the medical director or team physician of that hospice. However, sometimes the medical director wants to manage the care. At Assisted, we're very good at accommodating that, and we welcome that. We work with a lot of physicians who are concierge physicians, and they're very, very involved with their patients, and they want to either co-manage care with our doctor or manage the care completely, and we're very, very happy to work with them. Now, sometimes there will be an issue of contracts with insurance. Most of our patients are Medicare. Nowadays, so many Medicare patients are part of the Medicare Advantage program, and they're with HMOs. Medicare actually carves out the hospice benefit, so we don't go through the HMO for billing. We bill Medicare directly. And HMO may say, we're contracted with XYZ Hospice, but because Medicare has carved out the hospice benefit, the patient and family can choose whichever hospice they would like to work with. If a patient doesn't have Medicare, then there is an issue. You want to make a choice. If we have a younger patient and they have Blue Cross insurance, and you want to make sure, am I going to use a hospice that's contracted with Blue Shield? What are my co-payments and so on?
Who then pays that hospice bill?
For Medicare, Medicare pays 100%. There's no deductible and there's no co-payment. For younger patients, it depends on their insurance. We always verify insurance benefits ahead of time. We always let patients know ahead of time what their benefits are, whether they have a co-payment. A lot of the time, patients have already met their stop loss, so the insurance is paying 100% anyway. But we want everyone to be informed, and we get that information before starting care.
Is it important that the hospice that I work with is local, or can that hospice be in Riverside?
I always think it's better to work with local providers, which is another reason the Santa Clarita Senior Resource Alliance is such a good thing, because you can find out who the local providers are in the area. One of the reasons you want someone local is that you want to make sure you're going to get a quick response time. When you call the office, typically a hospice has nurses available in the office, but what's going to happen at 2 o'clock in the morning when the patient falls? You need somebody who can get there quickly.
And that really becomes extremely, extremely important. I know that at Home Instead, we work with a lot of clients that their doctors have recommended a specific hospice. One instance stands out in my mind. The doctor recommended a hospice in Camarillo. And, of course, emergency upon emergency happened to that patient. And the response time of the independent nurses, because they were essentially not working for the hospice, they were working as from a registry, the response time of that group was between 2 to 3 hours. Just from the time they got the call to the time they arrived at the patient. And that's just not acceptable.
No, that's completely unacceptable. You need quick response and you need quality response.
Absolutely. You're listening to Senior Moments. We're talking about how can the Santa Clarita Senior Resource Alliance help you. on Santa Clarita's hometown station, KHTS, AM 1220. We will be right back. This is Senior Moments on Santa Clarita's hometown station, AM 1220, KHTS. I am Joel Green. We've been talking about how can the Santa Clarita Senior Resource Alliance help you. Our guests today were Mary Damkowski, Marketing Director, and Flora of Oakmont of Santa Clarita, and Flora Greenhill of Assisted Home Hospice. So, how can the Resource Alliance help you? Well, we can help you in many ways. The easiest thing to do is if you do have a question of any of the members of the Santa Clarita Senior Resource Alliance, you can reach us at 296-8266. You can also go on the web and reach us at Senior Resource, delete one of those middle R's, alliance.org. That's the Santa Clarita Senior Resource Alliance. Mary, closing thoughts.
Well, I just wanted to share with everyone that, when it pertains to assisted living and when you're looking at communities, just to reiterate what was said earlier, make a visit, do your homework, ask questions, meet the executive director, ask if you can possibly have a lunch there, bring your loved one to see the community. When you're walking about the community, talk to the residents that live there, and ask them how long have you lived here. Do you enjoy living here? Because they're going to be the true ones to share their experiences. We are, again, scheduled to open in January. We welcome you to come for a tour of Oakmont. We will be having some great events coming up prior to opening. We have a Toys for Tots kickoff on this Saturday, December 12th. I believe it's at 4 p.m. And we will be doing a tree lighting ceremony the week of Christmas. And we would just love to invite the community to come out and see what Oakmont has to offer. Again, very excited to be part of Oakmont as well as be a member of the Senior Resource Alliance.
And how could people reach you, Mary, to set up a tour or just ask questions?
You can call us. Our number is 661-295-2025. Our website is oakmontofsantaclarita.com. Our address is 28650 Newhall Ranch Road. We are between Rye Canyon, Copper Hill, and the 5 freeway. You can call to schedule a tour. You can stop by, and myself and one of the other wonderful staff would be happy to show you what we have to offer.
And Flora, closing thoughts as well.
Thank you, Joel. I just want to say hospice, the thought of hospice is scary and frightening, and it can be fraught with all kinds of emotional angst. But take the time to explore. I do meet with a lot of families just to talk about different options. Feel free to call me. We have a Santa Clarita team. I'm here in Santa Clarita. You can reach me at 661-607-7305 or our website, www.assistedroman1.com, and feel free to ask questions.
And closing thoughts from me at Home Instead Senior Care is we are one of those companies, possibly the only company that answers telephone calls live. The telephone number is 254-8701. That would be 24/7 we answer live. Because when people call for home care and they're calling off business hours, it's usually an emergency. And that's the kind of response that you would want from a reputable home care company that you might be thinking of. You can contact us at the Santa Clarita Senior Resource Alliance at 296-8266. This is Senior Moments, brought to you by the Santa Clarita Senior Resource Alliance on AM 1220 KHTS. We are back next week 10 to 11, we're going to do a follow-up show on how the Santa Clarita Senior Resource Alliance can help you.